Hello to all my listeners and welcome to the CardioSeeds podcast that is all about lifestyle medicine and provider burnout. I'm your host, Dr. Svetlana Chamoun, a double board certified preventive cardiologist, lifestyle medicine physician, and health and wellness coach from the suburbs of Philadelphia. My amazing guests include absolutely cool physicians and other healthcare providers, and all of them have unbelievable stories to tell, from incredible personal tales of survival and resilience to becoming successful entrepreneurs, to starting blue zones from scratch, and much, much more. Tune into CardioSeeds podcast and listen to my discussion on a variety of lifestyle medicine topics. Starting a podcast was one of the best decisions I made in my life, and now we are available on every platform with a robust following from you, our listeners. Of course, none of this would be possible without Buzzsprout that let us build this podcast from scratch and launch it very, very efficiently. So, if you are dreaming about having your own podcast for the first time, Buzzsprout should be your choice. And with that, let's get started. And tonight's topic is burnout in medicine. What a horrible and complicated topic, but we have to dissect it. And there's no choice, but let's get started. So, you know me already. I'm Dr. Svetlana Chamoun, and I am a founder and president of CardioSeeds. So, what is CardioSeeds? In short, CardioSeeds is a company that I started several months ago in order to help physicians with burnout prevention and career pivot. And you ask me, why on earth would I quit my very successful career after 20 years of being a cardiologist in America and leave it all behind to risk it all and start my own company with all unknowns ahead of me? And I will tell you. In 2007, I experienced the most severe burnout in my life. It was caused by being a single mom of two and a very busy cardiologist in private practice. And I had to dramatically change my life and my career. And then I found a much better work-life balance. And when it happened, I was happy and healthier for a while. However, 14 years later, I was feeling that life was catching up with me again. I was accumulating stress, weight, pains, and aches, and not taking good care of myself. This is when I radically pivoted my career into this particular field, and I started CardioSeeds, and it profoundly changed my life. So this is when I told myself that really minimizing stresses in life was a paramount priority for both my mental and physical health, and that my life was worth every minute of it. I realized that my mission in life was not accomplished until I achieved both my personal best health and taught my fellow physicians and my patients how to do just the same. So I started CardioSeeds LLC, a company that specializes in physician burnout prevention, management, and career pivot through behavioral coaching and lifestyle interventions. Now let's take a deep breath and pause for a second, and we will talk about all of those things a little bit later. But for now, let's talk about burnout itself. Why burnout and why it's dangerous and why it's important. Well, first of all, if you are even listening to this podcast, it's, highly likely that you are experiencing burnout in some sort of either at work or at life or both. And, you may need help now, you may need help later, and maybe you are also experiencing a whole slew of other chronic medical issues. And, I can tell you, don't worry, you are not alone. And you're absolutely not alone, because burnout is one of the most serious problems at workplace and among the physicians in the 21st century. Physician burnout is one of the untold, underestimated, and undertreated tragedies of our generation. But we will help you through the tough times. So I'm extending my hand to you, and I'm telling you, I will help you whatever it takes. And every step of the way, I will walk with you to get you out of this pit, because I've been there, done that, and I kind of know what it takes to overcome the burnout. Every day, one doctor dies in the United States by suicide. New research shows that the number of doctors' suicides, up to 40 per 100,000, is 3 times, just think about it, 3 times that of the general population. Burnout is very dangerous. People who experience chronic burnout have a 25 to 35% high risk of early mortality. And early mortality, we're talking under the age of 45. Risk of pain problems, a whopping 200% high risk of developing type 2 diabetes, and a 3 times more likely to develop coronary heart disease and depression. So, as I said, at CardioSeeds, we know all about physician burnout firsthand, because we lived through it and survived. By we, I mean myself. We also know how to deal with it, because we emerged victorious and stronger than ever. We know how to snap out of the most severe burnout, how to find work-life balance and remain in the best health, both physical and mental, despite all the odds. So once we start working together, you too will be on the path of reaching the best individual state of health and wellness. Now, let's talk about burnout more. Burnout, as I said, is very, very common. And I think that physician burnout prevention and management is a number one priority of the American health system. Why? Because physicians who are sick and so tired that they are unable to take care of themselves are unable to take good care of their patients. More than 70% of the U.S. workforce reported some degree of burnout symptoms in 2021. A quote, traditional and quote, corporate culture emphasizes improving customer satisfaction while reducing overall costs. This goal has been often achieved by, quote, doing more with less, end quote. This strategy puts lots of pressure on existing workforce and creates an unfavorable work environment and leads to a high degree of burnout and turnover. You know all of this. The backbone of any effective corporation or workforce is an engaged and productive workforce that finds joy and meaning in their work. Now, let's talk about us physicians. Let's think about all of those things I just mentioned in the prism of healthcare, hospital, and our work environment. A hostile work environment for physicians, combined with a lack of support system and misaligned values between physicians and hospital medical system administrations, often leads to our burnout, depression, self-medicating with drugs, alcohol, pills, and even, as I said, suicidal ideation that plagues 7% of us physicians. So, natural optimizing workload and work-life balance and improving office design and cafeteria food, as elementary as it sounds, and perfecting communication between us physicians and administration. All of this would help to optimize our experience and decrease our burnout, right? Right. The following disturbing research data were presented at the American Psychiatric Association in 2018 annual meeting. 61% of physicians reported burnout symptoms in 2021. It was up from 40% in 2018. Well, it could be related to the emergence of COVID between 2018 and 2021. It's possible. However, it does not matter. It was up from 40% to 61%. Close to 7%, as I said, of U.S. physicians reported suicidal thoughts in 2021. I mean, 7%. It's almost 1 in 10 walking around us thinking of killing themselves. The suicide rate among U.S. physicians is higher than in any other profession, including the military. Guys, let's pause and think about it, okay? Let's think about it. Every day, one doctor, one of us, dies in the U.S. by suicide. So, the rate in the general population, the suicide rate, is 12.3 people per 100,000 people. The rate of doctor suicide is 40 per 100,000. 40. It's 3 times that of the general population. Okay? 3 times. So what's wrong with us? Or what's wrong with the environment that is around us that makes us so vulnerable to depression, burnout, and suicide? Let's dissect this situation carefully. The current healthcare environment emphasizes accomplishing a so-called triple aim. And we know what that beast of the triple aim is: improving population health and enhancing patient experience while reducing overall cost at all costs, right? Right. The achievement of the triple aim requires highly effective healthcare organizations. However, let's remember one thing. The backbone of the effective healthcare system is what? Engaged and productive. Who? Workforce is us. Well, of course, nurses, nurse aides, etc., but physicians included, right? The triple aim does not explicitly acknowledge the critical role of physicians in healthcare transformation. We, however, should find joy and meaning in our work to contribute to the triple aim achievement of it, at least. Instead, the hospital administration often does not focus on patient satisfaction and lowering cost, and conveniently forgets the needs of the physician, the very, very workhorse of the hospital. As a result, we physicians are routinely unnecessarily burdened with many things. The first thing is inefficient and complicated electronic health records, EHR, electronic medical records, EMR, whatever you call them, they are the beasts. Unnecessarily clerical work, inadequate time for documentation, sometimes spilled into our spare time after work, huge workloads. Don't even get me started. 15 minutes per patient per visit, and up to 35 patients per day in the office, plus other work, right? And lack of basic needs like offices without windows, poor ventilation, absence of bathroom in the office, unhealthy cafeteria food choices, lack of physician lounges, etc., etc., etc. You name it. So just think about your office, or you may be sharing your office actually with 3-4 other physicians. I would not be surprised. So in the past, or actually it just crossed my mind. So maybe your co-workers like nurses or medical assistants may be calling you by your first name. Hey, Mike. Hey, Brian. Hey, Barbara. What about Dr. Smith? What about Dr. Brown? Where did they go? It was all in the past, in the 80s and the 90s, right? Well, now it's like, hi, Brian. Well, where is that respect? How on earth patients will respect us? How on earth anybody on earth respects us if it's hi, Brian and hi, Barbara, right? Where is the 20 years of training and doctor after our name, right? Or before our name? Where did that go? As a result, there is a significant decline in respect towards physicians from medical system and hospital administration who make executive decisions without considering physicians' options. So that is misalignment of values between the hospital administration and us physicians. In addition, lack of respect, as I mentioned, from medical personnel and very patients. And sometimes elementary lack of safety at workplace compounds the workplace burnout. Finally, there is a persistent bias towards physicians' mental health, resulting in doctors delaying or avoiding seeking help with severe burnout symptoms and depressions, including avoiding free anonymous lines. By the way, they're not that anonymous. I've heard multiple complaints that the moment doctor picks up that phone, everybody knows. Okay, so all of the above creates a hostile work environment for doctors, combined with a lack of support system and misaligned values. This deadly combination leads to doctors' burnout, depression, self-medicating with alcohol, and committing suicide, sometimes as a final horrific act of desperation. So, the absence of clinician well-being has a negative impact on achievement of the DipABLM of healthcare. It's obvious that the time has come to bring physicians' health and well-being into the picture. And instead of the triple aim, there is a need to create the quadruple aim. Not just declare creating the quadruple aim, but obviously creating it in the concrete steps XYZ, with the fourth component being physicians' wellness, resilience, and job satisfaction. So all of those things that I mentioned, like overburdening with EMR, insufficient time for documentation, huge workload, all of those should go away. Physicians should have places to relax. Physicians should have lounges to relax, great cafeteria food, large offices, improved staff interaction, a lot of respect at work, time for their exercise, etc., improved work-life balance, and perfection of the communication between physicians and administration, and participation in decision-making that includes their work and work-related issues. This is when all of those things will be improved, and physicians will feel like their work is not actually going into the drain. Okay, and they are part of the system, that they're valued. Actually, being valued is, or the lack of feeling of being valued at workplace is one of the most important components contributing to work burnout. So, why burnout is dangerous, actually? Burnout is dangerous because when it accumulates, it leads to significant chronic diseases. So when we're talking about chronic diseases, cardiovascular disease, depression, all this overweight, obesity, diabetes mellitus, hypertension, arthritis, low back pain, substance abuse, sleeplessness or, insomnia, domestic problems, depression, I already said, suicidal ideations, then traffic accidents, they are directly stemming, in case of physicians, maybe directly stemming from burnout at workplace. Now, 6 in 10 Americans now suffer from chronic disease, and 4 in 10 have multiple chronic conditions. And chronic disease is responsible in 7 of 10 deaths each year. And when a work environment, creates such stress and burnout that physician is subjected to years and years of situation that compounds severe burnout and inability to seek help, mental help for burnout, and also a lack of personal time to even look at them, themselves carefully or seek medical attention for maybe brewing chronic diseases. Well, that is not acceptable because physicians, this is how physicians develop all kind of chronic diseases that go unattended, maybe even somehow develop cancers that go unattended for years until they reach, late stages and go unattended. How on earth can they take care of patients when they're so burnt out? There's no way they can take care of patients when they're so burnt out. So, by the way, we're talking about burnout. What is the definition of burnout? Merriam-Webster Dictionary, there are 3 definitions of burnout. One is the cessation of operation, usually of a jet or rocket engine. Number 2, exhaustion of physical or emotional strength or motivation, usually as a result of prolonged stress or frustration. And number 3, a person showing the effect of drug abuse. Okay. If the exhaustion from work is so severe that the academic dictionary literally compares its effect on our bodies to drug abuse, then there is a problem, don't you think? Okay, let's look at the Oxford Dictionary. Here we go. Number 1, the state of being extremely tired or ill, either physically or mentally, because you have worked too hard. And this is the definition that includes the word ill, then I actually have a problem with it, because if this is remotely true, then the work-related burnout is putting all us out of commission, dear colleagues. And the second definition in the Oxford Dictionary is the same. The point at which a rocket has used all of its fuel and has no more power. Oh, great. So we rockets have used all our fuel and have no more power. And as human beings, actually we worked too hard and got physically or mentally ill. So that means, dear colleagues, that it's time for us to actually start taking care of ourselves. Why? Because we are ill, and it's a form of exhaustion because we feel constantly being swamped, and it's a result of excessive and prolonged emotional, physical, and mental stress. And it's directly related to our job. We are overwhelmed, emotional and physically drained because of our lives and work's incessant demands. Well, I can tell you two things. One bad and one good. You want a bad news first? Okay, I will give you bad news first. No matter how much we fight about the burnout at work, there is no such a diagnosis as burnout at work, okay, or burnout at all. So burnout is not included in DSM-5. It's no such diagnosis, despite the fact that it causes multiple and complex problems on physical and mental levels. After much push by the World Health Organization, burnout is finally included in the 11th revision of International Classification of Diseases, or ICD-11, but only as an occupational phenomenon. It's not classified as a medical condition. Okay, so it's classified as an occupational phenomenon under problems relating to employment or underemployment. So here we go. And it's actually conceptualized as a resultant from chronic workplace stress that has not been successfully managed. So it's characterized by three dimensions: feeling of energy depletion, exhaustion, increased mental distance from one's job, or feeling negativism or cynicism related to one's job, and sense of ineffectiveness and lack of accomplishment. So these are characteristic of International Classification of Diseases in 11th revision of the WHO ICD-11. So three characteristics, and this burnout, the code is QD85 burnout, and it's separated from adjustment disorder, from mood disorders, anxiety-related disorders, etc. So finally, we got a definition, but it's not a medical disease. But it's better than nothing. So coming back to CardioSeeds and other things. At CardioSeeds, we created a special domain for physicians to manage burnout. So we are offering programs. Actually, we decided to become a safe haven for physicians who have burnout and would like to work with us, on burnout prevention and possible career pivot, just because we really care about you guys and want to help you out. And we know that even to acknowledge this situation may be difficult, and you may not even realize that symptoms that you experience, like chronic headaches or low back pain or neck pain or irritability or inability to sleep or fall asleep, etc., or even snapping at your wife or a husband, or your disinterest in your work, or some sort of kind of lack of accomplishment, etc. It's symptom of severe burnout. So we are there for you. We created a multi-step program for burnout coaching that incorporates lifestyle interventions, and we call it RECLAIM. RECLAIM is an acronym that stands for Recognize, Evaluate, Coach, Love, Action Plan, Implement, and Maintain. And actually those letters stand for many, many more things. We work with physicians on individual basis. It's strictly confidential. It's 100% virtual. And, we really apply behavioral coaching, lifestyle intervention in a very, very personalized manner. So I think that I'm qualified as a lifestyle physician and a health and wellness coach to do those things with you. And I am very happy to help you with anything that you need. First session is always free. We will really carve our sessions and our schedule to your schedule. I know that you guys are super busy and we don't want to encroach on your schedule. In fact, somebody told me recently, how on earth can I do it if I stand in the OR all day long and then I come back home and my wife wants me to take my kids to all kind of soccer game, etc. But I know that you guys exercise. I know that you walk sometimes, or you drive to work. You drive to work sometimes for 20, 30 minutes. So we can do our talks, our little talking sessions. It doesn't have to be Zoom with face-to-face. It can be just, Zoom with voice only, because coaching sessions provided to be extremely helpful even on the phone. So I'm there for you. Check it out. I will give you lifestyle prescriptions for those things that you need. Not everybody needs to quit smoking, but some people need to, reduce amount of drinking alcohol or sleep better. I will teach you how to do that, how to take care of your meditation, breathing techniques, etc., etc. But mainly, we will work on a significant reduction of your burnout, and we will work with you on potential career pivot if you consider that, if you want to do that. You will be, driving at the helm of the ship. You are the driving force of your transformation, and I will be helping you all the way with it. So don't be shy. Visit CardioSeeds.com. It's the website where you can find how to contact us, www.CardioSeeds.com. Or you contact me through my email, Chamoun@CardioSeeds.com. It's CHAMOUN @CardioSeeds.com. And shoot me an email and I will get back to you. But website, it's CardioSeeds.com, where you can find how to contact me and shoot me an email, and we'll get together. First session free, and we will get you what you need. Okay, so I love you guys. I care about you, and I will see you soon. Let's make this burnout history. And by the way, I will try to make sure that we will work together until you are perfectly burnout free. So I will not leave you behind or not leave you hanging there. Okay. I love you guys. Send me a message. Bye-bye. Have a good night.